I believe that everyone can succeed in science. We just need to explain it in the right way, a way that makes sense to you. As promised, this is my second video looking at the menstrual cycle, and it follows on from the first video, which looked at how hormones control the menstrual cycle. In this video, we'll look at how drugs can be used to control the menstrual cycle, for example, in IVF and contraception. If you haven't already watched my part 1 video, I would really recommend doing that first, because this video assumes that you know everything covered in part 1. So let's get started. If you're new here, welcome to BioSmash. I'm Jo, I'm a science teacher. I'll help you smash biology revision. I've split the video into 6 chapters. Feel free to jump ahead to the ones that you need. There's a test at the end as well, so you can check how much you've remembered and understood. So let's get started and just recap the hormones that are important for the menstrual cycle. In the first video of this series, we looked at 4 important hormones. Let's briefly recap what each one does. Follicle stimulating hormone is the first hormone to be released in the menstrual cycle. It's released by the pituitary gland. This hormone stimulates one egg to start to mature in the ovary. FSH also stimulates the ovary to start to release the second hormone, which is called estrogen. Estrogen hormone travels back to the pituitary gland and tells it to stop releasing any more FSH. So estrogen inhibits FSH. Estrogen also tells the uterus linings to start to thicken. And estrogen triggers the pituitary gland to release a hormone called LH. LH, or luteinizing hormone, triggers the release of an egg from the ovary on day 14, and this is called ovulation. When the egg is released from the ovary, this leaves behind a follicle, and the follicle starts to release a hormone called progesterone. Progesterone has a few roles. One of these is to travel to the uterus lining and keep it nice and thick in case there's a pregnancy. Progesterone also travels to the pituitary gland and switches off release of FSH and LH so that these levels stay low. In this next section, we'll look at how hormones can be used to increase fertility. As we covered in the first video about the menstrual cycle, women are born with all of their eggs in the ovary. Once a woman reaches reproductive age, every month one of the eggs in the ovary will start to mature. And on day 14 of the menstrual cycle, the mature egg is released from the ovary and travels down the oviduct towards the uterus. This release is called ovulation. And if the released egg is fertilised, this will result in a pregnancy. Some women have lower levels of follicle stimulating hormone. This means that there isn't enough FSH to cause any eggs to mature in the ovary. And this means there's no ovulation, which means the woman can't get pregnant. If a woman is struggling to conceive a pregnancy because her FSH levels are too low, she can be given the hormones FSH and LH. Adding extra FSH and LH to her body increases her hormone levels, and this causes eggs to start to mature in her ovaries. And this leads to ovulation and the release of an egg from the ovary, which could be fertilized, resulting in pregnancy. The advantage of this treatment is that it gives the woman an increased chance of conceiving a pregnancy. However, there are risks as well. It could be expensive, particularly if it doesn't work the first time. There's a risk of a multiple pregnancy, such as twins or triplets, if more than one egg is released from the ovary at once. And the treatment isn't always successful, so sometimes it won't work. In this section, we're going to be looking at IVF and how hormones are used. IVF stands for in vitro fertilisation. It's when fertilisation happens outside of the body. A couple may choose to have IVF if they're struggling to conceive a pregnancy naturally. For example, if the man has a low sperm count, which means there aren't that many sperm in his sample. In IVF, the eggs are fertilised inside a lab rather than inside the woman's body. The woman is injected with the hormones FSH and LH. These hormones cause several eggs to mature inside the woman's ovaries. As we've discussed already, in the normal menstrual cycle, one egg will mature in an ovary every month. If a woman is injected with FSH and LH, it tricks her body so that more eggs mature in the ovary than normally would. These are shown in pink. Once the eggs are mature, the woman has a procedure in the hospital to remove the eggs from her ovaries. This involves inserting a syringe into the ovary to collect the eggs, and each egg is placed in a little dish in the laboratory. Sperm cells are then added to each egg in the hope that they'll fertilise them. If the man has a low sperm count, there won't be many sperm present in his sample, so the sperm might be directly injected into the egg. This is called ICSI. Eggs that are fertilised start to divide to form balls of cells called embryos, and at around 5 days old, the embryo can be transferred into the woman's womb or uterus. This process is shown here. You can see the little embryo nestling into the wall of the uterus, and hopefully this will result in a pregnancy. So the obvious advantage is that it gives couples an increased chance of having a pregnancy if they're having trouble conceiving one naturally. However, if several embryos are transferred into the womb at the same time, this carries a higher risk of a multiple pregnancy, such as twins or triplets, and these have a higher risk of miscarriage or stillbirth. IVF has a relatively low success rate of about 26%, so it's a really difficult process to go through. This can make it really emotionally difficult if you go through the whole thing and don't end up with a pregnancy. Also, the hormones can cause physical symptoms for some women. For example, it might cause abdominal pain or vomiting and dehydration. Give this video a thumbs up if you're starting to understand this topic better. I hope this has all made sense so far. If there's anything you don't understand, feel free to go back and watch it before moving on to the next section. In this section, we'll look at how hormones can be used to prevent pregnancy. Let's start by looking at how the contraceptive pill works. When we talk about contraception, we're talking about ways that we can prevent conception or fertilisation from happening. This might be by preventing ovulation, because if the egg isn't released from the ovary, it can't be fertilised. Or contraception might work by stopping the sperm from reaching the egg so that they can't fertilise it. There are two types of contraceptive pill. The first, the combined pill, contains the hormones estrogen and progesterone. And then there's a progesterone-only pill, which doesn't contain estrogen. Let's look at how they work. Hopefully, you remember from earlier that FSH is the first hormone that's released in the menstrual cycle, and it stands for follicle stimulating hormone. And it stimulates an egg to mature in a follicle inside the ovary. We can summarise this on a diagram. The pituitary gland releases FSH, which travels through the blood to the ovary, where it stimulates an egg to start to mature. You might also remember that once the ovary starts to release estrogen, this tells the pituitary gland to stop making FSH. So when there's estrogen in the blood, the body doesn't release any FSH, so no more eggs will mature in the ovary. This means that if we give the woman's body estrogen, the estrogen will inhibit or stop the release of FSH. And if there's no FSH in the blood, then the ovary doesn't get the message to mature an egg in the ovary. If there's no egg released from the ovary, then no egg can be fertilised by any sperm. Another hormone that can be used in contraception is progesterone. Another role of progesterone is that it stimulates the reproductive system to produce a thick mucus. And this thick mucus prevents any sperm from reaching the egg. In an exam, you may be asked to compare different types of contraception, so you may compare the combined pill and the progesterone-only pill. So key things you could say about the combined pill are that it's over 99% effective, provided you follow the instructions correctly, that it does cause side effects, for example, headaches and nausea or feeling sick, and that a downside is that it doesn't protect against STDs, it just prevents pregnancy. On the other hand, the progesterone-only pill is just as effective if used correctly, but has fewer side effects, which is an advantage. However, its downside is that it also doesn't protect against sexually transmitted diseases. I really hope you're finding this video helpful. If you are, then please do click subscribe. It will help you to find my other videos. The contraceptive patch contains estrogen and progesterone. It's stuck to the skin and each patch is worn for 1 week. As a reminder, estrogen and progesterone inhibit or stop the pituitary gland from releasing FSH, which means that no eggs are told to mature in the ovary. Progesterone also inhibits luteinizing hormone and stimulates the reproductive system to make a thick mucus that prevents sperm from reaching the egg. The contraceptive implant works in a similar way. It's placed under the skin and releases progesterone continuously. A slightly different form of contraceptive is the intrauterine device, or IUD. This is T-shaped and it's placed into the uterus. When it's in there, it kills any sperm and prevents implantation of a fertilized egg cell. There are two types of IUD. The plastic one releases progesterone, And if a copper one is used, this prevents sperm from surviving in the uterus. Another form of contraception is the injection. Women are injected with progesterone, and each dose lasts for about 2 to 3 months. Some exam boards expect you to describe other forms of contraception, so I've summarised these briefly in the next section. There are also methods of avoiding pregnancy that do not rely on hormones and just work by preventing the sperm from reaching the egg. I'll summarise these ones really quickly. There are condoms, which act as a physical barrier, and condoms are the only form of contraception that also prevent against sexually transmitted infections. Women can use a diaphragm, which is a shallow plastic cup that fits over the cervix, which is the entrance to the uterus, so it forms a barrier. It needs to be used with spermicide, which is a chemical that kills sperm. Spermicide can also be used alone as a way of killing sperm. However, used this way, it's not as effective as the other forms of contraception. Another approach is sterilisation. Here, the woman has an operation in which her fallopian tubes or oviducts are cut or tied. So this means that the egg cannot get from the ovary to the uterus, and therefore it cannot meet sperm. Men can also undergo a similar procedure in which the tube called the sperm duct is cut. Now this means that the sperm cannot travel from the testes to the penis. Some people choose not to use any contraception and instead just avoid having sexual intercourse around the time of ovulation when the egg is likely to be in the fallopian tube or uterus. If you've reached this point in the video, you're clearly working really hard. A big well done to you. I've pulled together some questions so you can check how much you've remembered and understood. The questions will draw on ideas from both of the videos, so make sure you've watched both of them before going any further. I'm going to show you some statements, and the answer to each one is either FSH, estrogen, LH, progesterone, or a combination of these. So question 1. This one is released by the pituitary gland, is 2 marks, so it's 2 of the hormones on the list. Which ones are released by the pituitary gland? Number 2 is a 1 mark question, so we're just looking for one hormone. Which hormone stimulates an egg to mature in a follicle inside the ovary? Number 3 is another 2 mark question, so we're looking for 2 hormones. Which hormones are released from the ovary? Which hormone stops or inhibits the release of FSH? And number 5, which hormone inhibits the release of both FSH and LH? And finally, which hormones, so 2 of them, are used in contraception? The answers are coming up very soon, so pause the video now if you need more time. Learning keywords and definitions is a really good way to score more marks in your exams. I've made some resources to help you with this, so if you're interested, check out the link below. So number 1, the 2 hormones released by the pituitary gland are FSH and LH. Number 2, FSH stimulates an egg to mature in the follicle, and the clue is in the name. It stands for follicle stimulating hormone. Number 3, estrogen and progesterone are released from the ovary. I remember this because ovary is a single word and estrogen and progesterone are single words, where pituitary gland is more than one word, as are FSH and LH. Estrogen inhibits the release of just FSH, and the hormone progesterone inhibits the release of both FSH and LH, though technically progesterone could also be the answer to question 4. Finally, the 2 used in contraception are estrogen and progesterone. How did you do? Comment below and tell me your score. Well done for reaching the end of the video. Don't worry if you can't remember it all the first time. Just watch it again until you know all of the key ideas. And if you feel you've got the hang of this, then why not check out this video next? I hope to see you again soon.